My name is Dr. Fanous. I'm a neurosurgeon at Inova Alexandria Hospital, and I'm here to talk to you today about sacroiliac joint disease as cause for low back pain. Low back pain affects up to 80% of people worldwide. In the United States alone, it affects up to 50% of working Americans. It's the third most common cause of visiting a doctor's office, and it costs the healthcare industry up to $50 billion every year in the United States alone. Sacroiliac joint disease is one of the leading causes of low back pain. The sacroiliac joint is this joint here that connects the sacrum, which is the lowest part of the spine, to the ilium, which is part of the pelvis. The function of the sacroiliac joint includes very minimal rotation of the spine over the pelvis and also very minimal translation of the sacrum over the ilium. The sacroiliac joint has a lot of innervation. It's a very functional joint, and therefore it's also a cause of pain. Studies have shown that up to 30% of patients with low back pain have sacroiliac joint disease as the cause of their pain. And studies have also shown that up to 40% of patients who have had a failed lumbar or lumbosacral fusion have the sacroiliac joint disease as a cause for their low back pain. Sacroiliac joint disease is a serious condition in terms of the burden of the disease is up there, right next to very severe conditions such as Parkinson's disease and COPD. Causes of sacroiliac joint disease are various, but they include trauma, whether it's a major trauma like a car accident, or even a minor trauma like bending or twisting or falling down. Other causes include pregnancy or previous surgery to the spine, including the lumbar spine or the lumbosacral spine. To diagnose sacroiliac joint disease, the first step is to visit a practitioner's office, whether it's a spine surgeon or even sometimes a primary care physician. And there are certain maneuvers that are done in the office to diagnose this condition. Once those maneuvers are positive and there is a very high suspicion that this is what's going on and that this is the cause for the lumbar and the low back pain, then the next step in diagnosis is to refer the patient to receive injection to the sacroiliac joint. Those injections are usually done with anesthetics such as lidocaine. If the patient receives significant improvement in his or her low back pain following those injections of the sacroiliac joint, then this is very diagnostic for sacroiliac joint disease. Once diagnosis is made, then the treatment options usually start with conservative treatment. Those include physical therapy, pain medications, or outside bracing. If those measures fail, the next step is usually referring the patient for a therapeutic injection using steroids. Most patients receive significant improvement in their pain with the steroid injection. However, this is not a long-lasting treatment. It may last up to few weeks, maybe months, sometimes even years, but it's not something that will last forever. The only durable option of treatment is sacroiliac joint fusion. Fusion of the sacroiliac joint is a very quick procedure. It usually lasts less than 1 hour. It's done here in Inova Alexandria Hospital using state-of-the-art equipment and stereotactic navigation. Studies have shown that the rate of patient satisfaction following this fusion is very high. It's over 90%. And those studies have also shown that there is a significant decrease in opioid use following the surgery, as well as significant decrease in low back pain and significant decrease in disability scores. If you are interested in learning more about sacroiliac joint disease, please visit our website at www.inova.org. Again, my name is Dr. Fanous, and I'm a neurosurgeon at Inova Alexandria Hospital.